Hi, I am Dipti Adyaru. I stay in Delhi 3 years back. I was doing my daily normal chores in the house, and suddenly I realized that there's something wrong with my body. Now, what was wrong, I couldn't make out because I was absolutely normal. I had a tenderness in my breast, but which I associated with periods or before the onset of periods. It started more and more gradually, and the breast became hard. So I went to the gynecologist. She prescribed me a few medicines. She said, see, there are three things which can be the cause of this. It can be a ductal infection, it can be some infection, or it can be the big C. So she said, to rule out all possibilities, we start you on antibiotics. Well, fine, that was okay. I took antibiotics for nearly 15 days. Nothing materialized. Then a friend of mine who is also a doctor, she suggested that I go in for an FNSE. That's done with a needle. The place where they feel that it might be, there is some fluid, they take it out and have a test done on it. If it's positive, then there is something wrong in your body. If it's negative, then you don't have to be worried about it. My test unfortunately came negative. Even then, my friends suggested that no, I think you should go to a hospital where they would be conducting all the tests. So she suggested me Dharamshila. She said, you go to Dharamshila and meet this gynecologist there. I came to Dharamshila, I met the gynecologist, and she said, I would promptly advise you to see an oncologist who's dealing with breast. So I met an oncologist in this hospital, and he was very good. They again conducted a few tests, like a injectional biopsy, result of which was like coming after 4 days. So for those 4 days, I was in a dilemma. I didn't know what to do. I was like praying to God, I hope everything is all right, everything is all right. 4th day we came here and I met the doctor. He said, I'm sorry, but the result is positive. Now normally when you hear it's a positive sign, you think it's a good sign. But in my case, it was not a good sign. I was down with breast cancer. It didn't matter because my doctors were very good, and he explained the whole situation to me, because I burst out crying saying, oh, that's the end of my life. My son is still small. But he explained it to me very well. Me and my husband both were there, and he said, don't worry, this is not the end of the world. See, there are steps in which you have to go. You have to get your test done, which was a bone density test, your bone scan test, your body scan test, and you don't have to worry. I got all those tests done. Fortunately, the cancer had not metastasized anywhere. It was just locally. So then he explained it to us that I have to undergo the first round of chemo, which was 3 chemos, then a surgery, then again 3 chemos and a month of radiation. Now the moment I heard about chemo, I said, no way, because chemo is associated with many things. We hear many things about chemo, that oh, chemo is like the evil thing, monster, which would ultimately bring me down. Then the first thing that I told my husband in front of my doctor was, okay, fine, everything decides. I'm not going to wear a scarf and roam around with a bald head. I'm going to get a wig done first of all. So everyone was happy, everyone was smiling away, and I made a promise to myself that the chemo is not going to bring me down. And believe you me, the chemo doesn't bring anyone down. On the contrary, you are given medicines which everyone takes, and there is no way that you can go down with chemo, because we hear from people, अरे chemo से ये होता है, वो तो जहर होता है, ये तो वो होता है, इसमें आपको ये problem होती है. Nothing of that sort. All through the chemo, I just breezed through the chemo. Yes. There is one thing, that I had got a pot put in my main vena cava, that is, it's a small diaphragm which is put in your main veins, so that whenever you take a chemo, you just have to put that drip there. Otherwise, normally sometimes in the chemo you have patients who are suffering because you can't find the vein. But in my case, because of the pot, I had no issues. Even during my chemo, I used to take it out, go around, move around, come back and take the chemo. Yes, I did go bald, but I had my wig and my spirits and the backup of my family and friends, and the best was the doctors. You need a very good family support, in the sense that they should not allow you to come down. See, there are times when you feel down. You feel when you see your hair losing your hair, losing your eyebrows, losing your eyelid, eyelashes. You feel, what? How do I look? This is like, I never want to look like this. But that's nothing compared to your life. You need to take it in a positive way, take it in your stride. And believe me, chemo doesn't bring you down. On the contrary, if you adhere to what the doctors tell you, like they give you instructions, how to go about it, what not to eat, what to eat, you have no way that you have any problems in the chemo. After the chemo, I used to take a cycle of 21 days. After every 21 days, I used to take a chemo. And after that chemo, I got a surgery done. A surgery also went through very well. The hospital staff was very helpful, and it is still very helpful, for the simple reason that I come back for my follow-ups, and it's like, I don't feel like I'm coming to the hospital. I feel like as if I'm meeting my friends after a long time. And the most amazing thing that I can tell you is, like, I had my surgery on Saturday, and on Sunday when the doctor came for his round, I asked him, so he asked me, how are you feeling? I said, fine. So the first thing I asked him, doctor, can I go home? He said, okay, if you're feeling all right, go home. So that's it. I went home the very next day, like Saturday afternoon. In the evening, I was put into the room at 4 o'clock, and on Sunday afternoon at 1 o'clock, I was back home, and absolutely healthy, normal, doing my normal chores, no hassles at all. Everything was prim and proper. Not a single day went by when my house or my child had to suffer because of my illness. It was everyone, no one could come to know that I am down with cancer, or I am taking my chemo, or I had undergone a surgery. After the surgery, again after I think 21 days, we had a few tests done, and again my cycle of chemo started. Yes, there is one more thing in the chemo, that on the 7th to the 14th day of the chemo, you have to be extra careful, in the sense that that's the nadir period, when you have your count falling down. There are chances of your count falling down in the 7th to the 14th period, where you have to be very careful, in the sense, since your immunity is down, you tend to get infections. But for that as well, you are being given injections which keeps your count normal. You don't have to worry about your count. You don't have to worry about anything. In the drugs and the injection make you feel healthy. There is no way that the chemo does any effect on you. Yes, if you are mentally weak, then no one can help you. But if you are strong, if you have a positive frame of mind, if you have that willpower, no, I can fight it, and I will fight it. Nothing can stop you. After the surgery, and again after the 3 rounds of chemo, I had to go for radiation. Now again in radiation, people say sekai hoti hai, and they get scared and all that. But it was cool, because before the radiation, the preparations were done, as in, they marked the area and how much time to be given, and which are the places you need to be given. That also supervised by the doctors and the technicians here in the hospital. I used to come every day. It just takes about 2 minutes. I used to come every day. They gave me radiation. I went back, no problems. Yeah, the skin does get a little, not little, actually dark. It does get dark, but then it comes around after say about 6 months, 7 months, you are back to normal. You don't have any problems, and then you are put on a medicine depending on whether you are premenopausal or postmenopausal. They give you medicines, which is I think 1 tablet a day, and you have to take care that you don't get any infections, at least for the next 2 years, or any sort of difference in your body. If there is a difference in your body, you please get back to the doctors. But otherwise, you lead an absolutely normal life. You have no issues. I go swimming, I go playing, sometimes I go playing tennis, and I never ever for once did my son miss out on his school, or miss out on his school activities, or any other problems in the house, because I was always there. Like, what more could you get? On Saturday I had my surgery, Sunday I was back home, and my son and everyone was astonished. You had a major surgery yesterday and you are back home. Yes, I was, because I had that willpower. I had the support of my family. I had the support of my doctors, And most of all, it's all within you. You have to be very, very strong, mentally positive, and that attitude that yes, I can survive and I can fight it, because this can't pull me down. Cancer is not that a big thing that you get worried and you get down into the dumps and say, oh God, that's the end of my life. No, it's not, because you can see me. I never was a patient, I never will be, so you don't have to worry about it. Plus the doctors, the nurses, the staff here, they all helped me. They were very good. They were like my friends, and right now also when I come back to meet the doctor, they are all like, oh, how are you? You're looking so good. You're looking so fine. I mean, nothing more better than, that everyone would feel when a doctor sees, like when a mother sees a child all dressed up, she's very happy. My child looks so pretty. In the same way, a doctor says, oh, my patient is looking very good. That's, the result of your positive attitude, your mental strength, your willpower, that yes, I can do it. So please do not be worried about this. You can survive. It's not the end of the world or end of the road. You have to go through it with a happy smile on your face, and you will come out the winner like I have. Thanks.